So, morning, everyone. Can everyone hear all right at the back? Okay. Okay. Well, thank you very much for coming. I think there's a few more people on their way, but a few people said they may be a little late, so we thought that we would get started now to make the most of the day, because we've got quite a lot of ground to cover. So first of all, I'd just like to say, to introduce me, I'm Sylvia Meek, and I'm Technical Director of Malaria Consortium based here in UK. And just to let you know, over there we have our Chief Executive, Charles Nelson, but we'll have some quick round of introductions, so Charles will have a chance to introduce himself too. I'm really pleased to welcome you all to this event, and very great thanks to you all for your interest in coming to this. As you know, we're here to share our learning from a very large-scale integrated community case management program that we've been running in 4 countries in Africa over the last 4 years. And we'd like to discuss the impact on improving health of children under 5, especially looking at pneumonia, malaria, and diarrhea. As many of you here know, integrated community case management, or ICCM as we call it, is an approach that's developed quite quickly over recent years. And Malaria Consortium was very keen to engage from the outset in it, because it grew very much out of earlier work that we were engaged in on home-based management of fever. As an organisation, Malaria Consortium has got a great interest on how best to deliver services to people at risk of malaria. And with the availability of new tools for diagnosis at community level, this has opened great opportunities to ensure that access to much more appropriate management of illness is possible. So it really fitted in well with a lot of our earlier work. We're also very interested in the scope of integrating services to make limited resources do more good. And this is a topic that I think a lot of us are really paying a lot of attention to at the moment. Now, it's early days for ICCM, and there is a great global partnership developing. Many organizations are exploring it, trying to understand how best to deliver it, and looking at the big questions, obviously the biggest one of whether it works, and then also how to get maximum benefit from improving how it's done, and also trying to be clear on how to distinguish those two questions and make sure that we don't throw a good idea away by evaluating it when it's not being done to its best potential. So we wanted to take this opportunity to share our learning from this program as early as we could, but also really interested to get your ideas and comments and critiques at this stage as we develop our work in it further. Now, I think many of you know that as well as the people that are sitting here in the room, we do have an audience participating online through a webcast. They're obviously invisible, but I'm hoping that they're there somewhere. And we're really, if they can hear, we warmly invite them to participate as actively as they like by sending in questions and comments. And if anyone online sends in a comment, please do tell us your name and organisation and what's your interest in ICCM. And those questions will feed into our discussions. Okay, so before we actually start the presentations, and we have quite a few, I'd like to ask the participants in the room to introduce themselves, so you know who's who. So maybe we could start with this table. Eleni, do you want to start?
I work for GlaxoSmithKline in our community partnerships area in the emerging markets, and my key area of responsibility is that I manage a program where we reinvest 20% of our profits in least developed countries.
Good morning, Claire Strawn, Regional Public Health Specialist based in the Kampala office for Malaria Consortium.
Good morning, I'm Geoffrey Namara, the Africa M&E Specialist based in Kampala.
Frida Kesteng, I work for London School of Hygiene and Tropical Medicine. I'm a health economist, and I work with Malaria Consortium on the ICCM projects.
Good morning, I'm Karin Schelander. I'm a regional program coordinator for a project called InScale. I'm also based with Kampala office of Malaria Consortium.
Good morning, everyone. I'm Scott Filler. I'm the Senior Technical Advisor for Malaria at the Global Fund to fight AIDS, tuberculosis, and malaria.
I'm James Tebenarana, the Africa Technical Director for Malaria Consortium based in Kampala, Uganda.
Good morning. My name is Prudence Hamadi, and I'm the Senior Technical Advisor in the Malaria Consortium based in London.
I'm Ian Bolton, and I'm a trustee of the Malaria Consortium.
Marta Guglielmetti, a consultant for the Gates Foundation European Office.
I'm Marit de Wit. I'm the health advisor, the malaria advisor for Médecins Sans Frontières in Holland, and I'm here on behalf of the Intersectional Malaria Working Group for MSF.
Paul Ali from the malaria program at Novartis, based in Basel.
Dr. Henry Katamba, Monitoring and Evaluation Specialist, Malaria Control Program, Minister of Health, Uganda. I'm representing the Director General. Thank you.
My name is Harriet Cochrane. I'm the Health Program Manager at Comic Relief.
Anna Husking, Program Officer for AMREF.
James Sajtoreko. I'm the Acting Country Director for South Sudan, but formerly worked for ICCM project in Uganda.
My name is Alex Hume. I'm the Advocacy Officer at Malaria Consortium in London.
My name is Teresa Diaz. I'm the Chief of the Knowledge Management and Implementation Research Unit in the Health Section of UNICEF in New York.
I'm Charles Nelson. I'm the Chief Executive at Malaria Consortium based here in London.
James, did you introduce yourself?
Yes, I did.
Oh, good.
Helen,
Okay.
did you?
Okay.
CCM program based in Mozambique for Malaria Consortium.
Great. Okay, so for our morning session, James Tebendarana is going to be our chair, bringing in questions not only from people here, but also any of the online questions that come in. And we're going to start by having a presentation which will give you an overview of the main program that we're talking about this morning from Helen Coonahan, who has been managing that program for the last few years. Thanks.